Welcome to yet another exciting episode of Zaumoyo program. This is a program that brings you nothing but the best information on your health. Today we have a special guest that is going to discuss with us a certain topic that I am pretty sure you have not thought about. But this is why Zaumoyo is there. We are talking about, can you guess? Okay, we're talking about snake bites. Yes, you heard right. Now, looking at the information that we have, snake bites are dangerous and inflicts pain, which might cause death. And according to the World Health Organization estimates that about 70% of the snake bites causes are not reported. And if the 70% rule is applied to the data available at the Zambia Ministry of Health, the average total of the snake bites in Zambia per year is 77,665 bites and 118 deaths per year. As we discuss this topic, let's welcome our good doctor this week. Doctor, you're welcome.
Thank you so much, Jubel, for having me in your program for Zaumoyo, yes, which is very important in sensitizing the community about health matters.
Please introduce yourself.
All right, so my name is Dr. Lovasi Michelo. Okay, I'm a registrar at Chipata Central Hospital. I'm a trainee in general surgery, and we handle a lot of snake bites at our hospital.
Okay, as we start, what causes snake bites?
Okay, so firstly we have to understand that not all snakes are venomous. Okay, so we've got those that will bite a person and not put venom into their body. Okay, so those are dry bites, they're called as dry bites. Okay, and then we've got venomous snakes. So those are going to inject that poison into your system. So now what happens is that, and commonly you find that is in these people who are in farms, maybe in the bushes, they are hunting or they are headmen, and they go to where these snakes are found. Okay, it is said that snakes do not actually bite humans unless they are impeded in terms of where they are found. So if you go where they are found and you try to harm them, okay, they'll try to defend themselves. Yeah, so usually that's what happens. So you find that especially these young boys who go around playing, they are playing with snakes, so those are at more risk. Yes, and also those people who don't have protective clothing, so they go there and then they try to step on the snakes, they need to bite them. Others, it will just bite them without you trying to actually scare it or something. So it will just try to bite because it's trying to protect itself. Yeah. However, most of them will actually just try to run away from you unless you try to fight them. Okay. Yes.
All right. How can you protect yourself from being bitten by a snake?
Okay, so to begin with, like I said earlier, the risk factors that a person has to be bitten if they are not wearing any protective footwear. Okay, if you have maybe fishermen or farmers, they're not wearing gumboots, and then they'll easily be bitten on their foot. Okay, so one way of protecting is by wearing protective clothing. Yes, and then also because snakes are more active during the night. Okay, so we urge our communities, if they are going into the bushes or in the night, they should ensure that at least they have a torch, they can be able to see. And then also as they are walking, that sound is able to actually scare the snakes away. Yes, and also remember that these snakes like bushes. So if in our surroundings we are able to clear them, okay, there's hygiene around, we've cleared the bushes, there's less likelihood of these snakes coming to our households. So let's just ensure that the houses are clean and the like.
Now, Doc, according to the World Health Organization, Over 118 deaths are recorded annually due to snake bites. What is the cause of these deaths? And perhaps, is it lack of medicine or, late presentation of snake bites?
Yes, so the cause of death really depends on the type of snake that has bitten a person. Okay, yeah, I think in Zambia we have over 100 species of snakes, and I think only about 30 of them are venomous. Okay. Yes, so you would find that when these venomous snakes bit a person, okay, there are different types of toxins that they release into the system. There are toxins that will affect the cells of the body, and others that will affect the blood cells, others that will affect the nerves of the human body. So you find that those snakes that will cause damage to the nerves, to the blood cells, they're the ones which are more dangerous. Because if this patient is not going to present to us quickly, then they can actually even die in a very short period of time. Okay, an example is those who are bitten by black mambas. Okay, black mambas, spitting cobras, those are highly venomous. Okay, so if they delay to present to us, then you find that they can even die before they reach our facility. Yes, so the cause of death are those snake bites which are highly venomous. Okay, and that would cause destruction to various body systems.
How quick should one be in seeking medical attention when they're bitten by a snake?
Okay, thank you. So ideally, okay, someone who is bitten by a snake should present to the health facility as soon as possible, because we need to start monitoring them. Okay, because when this venom enters into the system, it progresses. Okay, so when they present to our facility, then we know how to manage them. At least even the health centers around, before they even refer to a central hospital, they are able to give supportive treatment to these patients. But also there can be first aid that can be given by people in the local communities.
Now, Doc, if many people do not seek medical attention, how do they get healed? I mean, there are issues to do with tradition and all that. And according to the estimates that we have seen, obviously there are a lot of people that are experiencing this, but coming to the health facilities to seek medical attention. By the way, is medication free, like when they come to the facility?
Yes, it is free. Yes, it is free, very much free. Our government does provide. So before I actually respond to that, when it comes to the treatment to these snake bites, okay, it depends whether it's complicated or not. Okay, but generally it's supportive. Okay, so in this supportive treatment, it consists of us giving anti-tetanus toxoid. Okay, we'll give them that. We're also going to give them fluids. We'll give them some painkillers. We'll also give them antibiotics, because we know that also in the mouth of these snakes there is also some bacteria. So there may be some infection also that comes, not just the venom, but also infections from the snake bite. So we also cover them on those antibiotics. And these are things which are found in these health facilities. Yeah, so you find that when they come through, they'll be able to access all this, and it will help to manage them. So now, as I said earlier, that most of these snake bites are non-venomous. Okay, so one who is being bitten may actually end up just healing spontaneously without seeking medical attention. Okay, however, there is that percentage, okay, that those 30 species that we have which are venomous. Okay, so when they are bitten by a venomous snake, those they have to report. Okay, so in general, everyone who is bitten by a snake, they need to come, because they won't know that this is venomous, this is not. Okay, it's better they come and then we monitor them and we say, okay, it's not venomous, then they go home, rather than it's venomous and then they are bitten, then they present late. because that's another cause of death, late presentation. Okay, maybe because they stay far, but others because the first thing that they will do, they will seek medicine from traditional healers. And these traditional healers are going to apply substances there. They will cut the area, and these are things that we are discouraging. Okay, because they're going to just worsen the venom. Okay, the injury, the damage will be more, and those cuts that they make, it will cause more bleeding, and the patient ends up just dying before they even reach the facility. Okay, so it's important that they report to the health facility as soon as possible, because us we're able to provide that supportive treatment, and also we can give antivenom in certain patients. Okay. Yes.
So what are some of the statistics that you have recorded, maybe in the past year or something, as according to the presentation of snake bites in Eastern Province?
Okay, so generally in Eastern Province, as of 2023, we had a total of 296 cases. But just within Chipata Central Hospital, we had a total of 66 that presented to us. Okay. But just this year, from January to February, we've had a total of 116, the entire province. And just in Chipata, we had 44. Wow. So as you can see, the numbers are quite high.
Okay. Wow. So 116 in just 2 months. Why is that so? I mean, is it because it is raining and snakes are running away from the mountains and all?
Yeah, so that's another factor. These snake bites are sort of seasonal. Okay. Okay. Yes, especially when it's very hot, because it can't be in the ground. Okay, so they seek for habitation elsewhere. And also that because it's raining, you know, the grass is growing. Yeah. Yes, so that means that these snakes will be in the grass, and people as they are walking, they can easily be bitten, because these snakes will be hiding in the grass. So in the rain season, we usually record a high number of these snake bites, and also because it's a farming season. Yes. Okay, so people are there in the field, and also people have gone to hunt. Okay, so you find that they are being predisposed to these snake bites. Okay. Yes.
Doc, do health facilities have the necessary equipment and medication to heal a person bitten by a snake that is readily available, or you just deal with referrals, especially looking at the fact that people are coming from different areas and accessibility to these health facilities might be a challenge, more especially that, you know, there's a long distance in between the community and these health facilities?
Okay, so like I mentioned in the treatment, it's largely supportive. Okay, so you find that all these health centers that we have in the province, they have the fluid, they have the painkillers, okay, they have the antibiotics. So when they come, we'll be able to give this support to them. So these drugs are already available. However, there are other treatments that may be needed. Remember, I talked about the type that would cause damage to blood cells and the like. So they are losing blood, and they're having low blood. So those might need a blood transfusion. So those have to be referred to a center like Chipata Central, where they need to receive that blood. Okay, and also those qualified to be in a category that need to receive the antivenom, which we have already available at the hospital. Okay, so if they are coming with the bleeding, okay, their bleeding, it can be controlled, or if they are coming with loss of consciousness, okay, or any other complications that will be affecting the systems, those we are going to give antivenom. Okay, one other complication that we usually have is what we call compartment syndrome.
What is that, Doc?
So compartment syndrome is where maybe you are bitten on the foot. Because of that venom, there is going to be swelling. That swelling increases the pressure which is there where these muscles, nerves, and blood vessels are. So when that pressure increases, it stops the blood supply to that area. It can even die off. Okay, what we call being gangrenous. Okay, meaning it dies off, it's dead. Why? Because of that pressure that it has in the muscle. So those have to be brought quickly to the hospital, because we need to open so that we can relieve that pressure before the muscles die off. Okay. Otherwise, we're going to lose that limb. And that's why some of another complication will be amputation. Especially if they come from a long distance, they have that complication. By the time they are reaching here, the limb is already gone. So we have no choice but just to amputate the limb.
Wow.
So it's quite a huge burden.
It's very bad.
Yes.
Now, Doc, you have spoken about the 30 species that are venomous. Maybe you can take us through at least 3 or 5 most dangerous snakes.
Okay, so of course they may not come with the snake or a picture of it. Yeah, so usually we can tell from the presentation that they are having. Okay, I talked of different examples. The topmost dangerous snake is the black mamba. Okay, and then also we've got spitting cobras. Those who also, they are highly venomous. Okay, and also vipers. Okay, like the puff adders as well. So those, when they bite a person, it means that they are going to develop complications, various complications that will affect the system. Okay, I talked about there are those that will just target to kill the cells of the body, those that will target the blood, and those that will target the neurons, okay, or the nerves that transmit impulses to the brain. So those can be targeted. So these 3 topmost, sometimes the patient may not even reach our facility. They would have died. Okay, yes. But those that managed to reach, we're able to resuscitate them and give them the necessary support. So
out of the 296 cases recorded last year, do we have records on those that succumbed to snake bites?
So we had a challenge with that information because some cases are not reported. Yes, so you find that they will just be recorded that they have presented with snake bite, but they follow up to that. Okay, how did the patient outcome? How was the outcome of the patient? So you find that we have poor recording in terms of how much those deaths are occurring. Okay,
Doc, what special aid is needed to be given to a person that has been bitten by a snake while it's at home before they can even reach the health facility?
Okay, of course, number one, you know that this patient is anxious. Yes. You know, yes. So now you have to calm them down. Okay, so this is our first aid. We calm the patient down. Okay, wherever they are in the bushes, in the rural areas, they have to calm them down. Because if they don't calm them down, that anxiety produces certain chemicals that will actually worsen the body's response to the venom. So the first thing to do is to calm them down. Okay, then after we've calmed them down now, okay, we need to immobilize this limb. Okay, make sure that we're not moving the limb. Okay, that is very important for us. After we do that, we need to rush them to the nearest health facility. Okay, because that's where much of the treatment will be given. Okay, so if we do not refer them, then they might develop those complications. Okay, then also there are certain things, because there are people that firstly they take the traditional healer, that delays them from presenting to the hospital. Okay, and also there are those that cut. So the same thing that they should not do. They should not cut, they should not apply anything, they should not tie a tourniquet. Okay, tourniquet are those you get a rope and then they'll tie it to say no, so that the venom does not go up.
We have always been told that we have to tie.
That is wrong. It should not be done, and we are discouraging the communities because when they tie, remember there is that complication I talked about for compartment syndrome. Yes, it will develop, and also that will just cause the venomous to spread quickly and cause more damage to the tissues. So we are discouraging the tourniquets. Yes, so that are some of the things that they can do immediately, okay, before they present to a health facility.
Whoa, I have been told that when one is bitten by a snake, you have to tie, especially the upper part where, you know, the affected area is. But like you have said, it's not advisable.
It's really wrong, yes. It's discouraged.
Okay.
Yes.
How How long does it take to treat a person who has been found or who has been bitten by a snake?
Okay, so it depends with the complication that has developed, okay, and also whether that bite is venomous or not. Okay, if they come, it's a non-venomous bite, we just treat them supportively. We can monitor them for 2 to 3 days, okay, and see if they are that complication I talked about, whether there will be swelling, severe pain, excessive bleeding. We keep them to monitor for those signs.
Yeah.
Okay, or if this venom has spread to other systems, because they will present with difficulties in breathing, dizziness, loss of consciousness. So sometimes this venom takes time to manifest, so we keep them to monitor for all those things. Yes, so it will depend on how they will present. The other that will present, like I said, where the limb is already rotten. So meaning we have to amputate the limb, or they've come with that complication, we need to cut so that we relieve the pressure. Okay, so when we do that again, we have to keep in and start cleaning the wound until it heals.
Yeah.
Okay, but if it's non-venomous, they've come, we've given them the supportive treatment I've talked about, they are okay. By day 3, they go home.
Okay.
Yes.
Doc, we have all this information that you have shared. And it's good that you have shared with us all this information. But then again, how well are you sensitizing the public on some of the things that one must do, especially when giving first aid to a person that has been, you know, bitten by a snake?
Okay, I think we are not doing so well when it comes to sensitization, okay, because the don'ts that I've talked about, they are still taking place.
Yeah.
Okay, so it means that there is still a gap. Yeah, and that's why this program is there. You're able to sensitize the community on these snake bites, which is a recommendable job.
Yeah.
Okay, yeah. So now we still do 2 radio programs. Okay, yes, we still talk about the snake bites. Even the patients that come to our facility, the bedsiders, we still talk to them, and then they go and talk to the communities. Okay, however, there's still a gap. We still have to go back to the communities just as a program to say we're going to sensitize them on snake bites. I think that would help so much, because remember that prevention is better than cure. We talked about how someone can protect themselves from these snake bites. So if that information is given to them, it will help. Before they present or before they are bitten by a snake, they would have already prevented it.
Okay. Well, you have heard for yourself. As Zambia, we have at least 100 species of snakes, and 30 of them are very venomous. Let me just say dangerous. And we have also heard that Eastern Province has recorded about 296 cases by last year, and 116 cases were recorded this year, just 2 months ago. So this is something that must tell you that it is something that we can continue talking about. And I think, yet again, this has proven to be something that we need to be doing all the time. That is why Zaumoyo is there to provide this information, because without Zaumoyo, you wouldn't have known in terms of snake bites and what they do here in Eastern Province. So I have been your host, Jubel Zulu. We thank you so much for being with us. We hope to see you next week as we bring you another topic which is going to be exciting as it was with this one. From the entire TV production, we say thank you so much. See you next time.